just a little bit more background about myself. So one of the things that I've been doing over the last 16 months is actually working with federal, state, and local response teams to help them either gather data or analyze data to help them make smarter policy decisions. And as a parent myself of a toddler, the issue or the question of how do we keep kids safe in schools has really hit home. One of the things that I want to point out is really just to take the baton from the earlier speakers and point out that several schools have these sort of dashboards. Not all parents are entirely aware that these dashboards exist, but this is an example of a dashboard for the LA Unified School District. And we can see a few things that we've already talked about, like the student staff case rate, the community case rate, the broader LA County case rate. And the reason this is important is because we were just earlier talking about some of the modeling and some of the assumptions that go into that modeling. And it's important to recognize that Delta really has changed things in very significant ways. This particular school, I've been tracking what's been going on in LAUSD specifically over the last few days. LAUSD started on Monday. They have a baseline rate that they calculated. So all schools started with 0 active cases in both of these boxes here. And since Monday, so yesterday, this particular school had 2 cases. Today they have 9. Across the LA Unified School District, there were 0 to start with on Monday, 70 yesterday, and 363 as of today. So that just gives you a sense for how quickly the Delta variant comes into the picture when it comes to schools. And one of the reasons why we're seeing that is that Delta variant replicates very, very quickly. I'm sure we've all heard the headlines about Delta variant having 1,000 times more viral load. Well, what does that mean? That means that that at the point at which you can actually detect the virus in a particular sample, the person is already more likely to be infectious. And so when we talk about Delta variant and when we talk about testing, the important take home point for parents is that the tests are not going to be perfect, and this is why we need masking, and we need more. We actually need vaccinations as well, because there's a period of time between the time that the person tests positive and that the person is already infectious. And for Delta variant, that can be between 18 and 72 hours, depending on how far we are from the testing. So what we see is exactly what we're seeing in LA Unified School District already. These numbers are going to keep going up, not just for this school, but for all schools. And as much as we'd like to think that that the high vaccination rate states are going to be safe from what we're hearing about in Mississippi and Alabama, the fact of the matter is that when you look at the underlying data, the problem is that there is just no vaccination for kids below 12. And what we're finding is that that particular age range is where we're seeing the biggest increase in both cases and hospitalizations. And so that goes back to an earlier part of the talk where we talk about hospital capacity. And if we look across the country, nationally, we are already pushing all-time highs in terms of the number of children in hospitals across the United States. We are virtually certain to break an all-time record within the next week to 2 weeks across the U.S. there is no state that doesn't have this particular shape of the curve. Now, on a day-to-day basis, we are, and this is the part that's really striking from a data standpoint, we've never admitted as many children to hospitals in such a short period of time. You can see, dating back to when we started collecting these data at the federal level, at the national level, in early August, the curve has never gone up that quickly in that short amount of time. And back to the point of this being I personally dislike the pandemic of the unvaccinated term. I think it's the pandemic of the innocent, because we have 75 million children in this country that that are exposed. Only a fraction of them are actually fully vaccinated. So what we see is that reflected. There is no state that's safe at the moment. We need to improve our we need to improve our testing protocols. We also need to improve our mask guidance and our ventilation for children. I will reiterate the importance of really pressing and considering the value or the ability to do more outdoor instruction or outdoor activities, because that is really the only those are the primary ways by which we're going to keep kids safe until we have vaccinations for all of them. Bigger picture, it's not just about the immediate case of COVID-19. There's this secondary effect of an inflammatory disorder called multi-system inflammatory syndrome for children. We can expect a similar sort of secondary wave of this ICU level syndrome within the next few weeks, as we get about 3 to 4 weeks away from these initial states that are reporting large cases. And then taking a further step back, we can't ignore the overwhelming data at this point that shows that long COVID, meaning it's just chronic lingering symptoms, is something that children actually deal with anywhere between, on a very, very conservative basis, about 1 in 100 children. More realistically, about 1 in 25 children will have lingering symptoms of either fatigue, chronic pain of sort of unfamiliar and vague nature, and difficulty focusing on a day-to-day basis that will linger beyond 4 weeks, and that data is getting stronger and stronger by the week. And so we have to consider, as a parent myself, I consider the immediate effect, the secondary effect of potentially risking a hospitalization later on, and then even thinking bigger picture as we think beyond the immediate course of COVID. And so as we think about what we can do, the thing that I hope that everyone watching this can take away is that it's important. These are policy decisions. These are policy choices, and to the extent that we have the ability to do something about it, we can always call our state legislators. We can call our congressional representatives. We can call our U.S. senators and press them to prioritize the health and safety of children. And as long as there's public pressure on making this a priority, we can improve masking, we can improve ventilation, and we can improve vaccinations for children.